Aloha and mahalo for choosing the Queens Medical Center. I'm Dr. Cedric Lorenzo, Bariatric Surgeon and Medical Director of the Queens Comprehensive Weight Management Program. In the next few minutes, we hope to share with you what makes our program so special and why the Queens Comprehensive Weight Management Program should be your preferred choice when it comes to your weight management needs. The Queens Weight Management Program was started in 2004 in response to the growing problems of obesity and diabetes. Nationwide, obesity rates have doubled in the last 20 years. In Hawaii, despite being considered one of the healthiest states in the nation, we still have an obesity rate of about 23%. Of that, 3 to 5% or 50,000 of Hawaii's residents are considered morbidly obese.
A person is considered morbidly obese when his or her body mass index, BMI, is 40 or higher. Normal BMI is 25. Another way of defining morbid obesity is being at least 100 pounds above your ideal body weight. Obesity is more than just outward appearance. It affects all of the major organ systems of the body. Obese people are more likely to have diabetes, high blood pressure, and elevated cholesterol. Obesity is also associated with an increased risk of certain types of cancer, including breast, colon, kidney, and prostate. Obesity affects your respiratory system and decreases overall lung function. It can cause sleep apnea, a disease that may cause you to stop breathing in your sleep. Obesity increases liver and gallbladder problems and contributes to infertility in women. It can also make problems you already have worse, like gout, arthritis, and blood clots. To make a change, there is no time like the present. The earlier you begin your weight loss journey, the less likely you are to develop heart disease, and the more likely it is that if you have diabetes, it can go into complete remission.
At the Queens Comprehensive Weight Management Program, we have multiple options for patients seeking to lose weight. You can choose to enter our non-surgical weight loss program or be evaluated for weight loss surgery, commonly known as bariatric surgery.
For patients who are interested in losing weight but do not qualify to have surgery or who would like to try something less invasive, the clinic offers options. All patients meet with me or one of the other bariatricians to review medical history and weight loss goals. At that time, we can formulate a personal plan to meet your needs. It may include one or more of the following: a medically supervised prescription meal replacement system called Quick 20, appointments with one of our registered dietitians to review calorie intake and meal planning, prescription medicines to help control appetite. Our weight loss philosophy is to provide you the support to achieve long-term weight loss success through sustainable diet and exercise programs.
So, when should you consider bariatric surgery? Many people decide to have bariatric surgery for various reasons. It becomes an option when your weight has negatively impacted your health and quality of life. And despite numerous attempts at losing weight, you just aren't able to get to a healthy weight. Your primary care provider can help you make that decision.
I saw my life, I couldn't do anything. I saw worthlessness in myself. I couldn't pick up things. I couldn't bend down. I couldn't tie my own shoe. It was really hard putting on my sock. It was just not right for me. In my mind, I'm thinking, I need to do this for myself. And not only for myself, for my family, for my children, my grandchildren. They're the ones that need me the most.
One of my coworkers actually had talked about it, and she said, "Hey, I've heard about Queens Comprehensive Weight Management. Do you want to sign up with me?" And she knew that I was kind of going through a period where I wasn't happy. I really was sluggish and tired. I wasn't being able to keep up with the other coordinators in my office, and I was the youngest. So I thought that was really unacceptable that here they are, you know, able to work all these different hours and stay super motivated, and I was not.
3 years ago, I got sick, had 3 strokes and a heart attack, which I didn't know about. And I wanted to see my grandchildren grow up to graduate and have their own family. And I decided to straighten out my life by myself because no one can do it for me by myself.
Our program sees patients between the ages of 21 to 70. You may qualify for bariatric surgery if your body mass index is 40 and above, or 35 to just under 40 with certain associated illnesses like diabetes, high blood pressure, or obstructive sleep apnea.
Patients should call their medical insurance carrier and ask if their particular health plan will cover bariatric surgery. Aside from surgery, what will also be covered are office visits for the medical treatment of obesity-related illnesses, mental health and behavioral counseling, and the necessary laboratory and diagnostic tests. What is usually not covered is our program fee, visits with the dietitian, dietary supplements like vitamins, and other cosmetic-type operations like those for the removal of the excess skin.
You also have to understand that surgery is a permanent decision and that you're ready to make the necessary lifestyle changes to live a healthier life. This includes making sure that you have no ongoing addictions to alcohol, illicit drugs, and tobacco or other forms of nicotine like e-cigs. We ask that all surgery patients be nicotine-free for at least 3 months prior to surgery.
The reason I decided to have bariatric surgery was, 1, my cardiologist recommended me to the program, and 2, I've just always struggled with my weight over the years. In 2006, I was diagnosed with thyroid cancer, and I don't have a thyroid, so I take medication. I was also diagnosed with sleep apnea, and I had really, really bad acid reflux.
I was 26 years old and I knew I wasn't going very far. It's too heavy and I wanted to live for my family and my nephews. It was hard in the beginning. I was trying to be sneaky and hard-headed, but the ladies at the weight management program really help, and they really keep you in line and keep you honest.
Early bariatric surgery has been shown to be safe and the best way to achieve long-lasting changes in metabolism. Weight loss surgery can give you real hope of a longer and brighter life for you and your family. To illustrate these points, let's compare the results of the most common weight loss strategies. Whether you try to lose weight by conventional methods, like diet and exercise, meal replacement systems, or prescription medications, your expected weight loss over 6 months is about 10% of your total body weight. For a 250-pound person, this is 25 pounds. By comparison, bariatric surgery patients typically lose 30 to 35% of their total body weight. For a 250-pound person, this is 75 to 85 pounds compared to 25 pounds for those who didn't have surgery. Long-term success is much greater. 65 to 85% of surgical patients are able to maintain their weight loss.
At the Queen's Comprehensive Weight Management Program, we offer 3 of the most common bariatric surgical options. All operations are performed using the latest in minimally invasive technology, including surgical endoscopy and robotics, to provide you the safest operation possible. Using these techniques, patients recover faster with less pain. Incisions are also smaller than traditional open surgery. The adjustable gastric band, or lap band, is a silicone belt with an inflatable balloon that is placed around the very top portion of your stomach. Over time, the balloon is gently filled, causing this belt to tighten. This tightening significantly reduces the amount of food you can eat. It tricks your brain into thinking that you are full, causing you to stop eating. By limiting how much you can eat, ultimately, you should lose about a pound a week. Typically, patients with an adjustable gastric band will lose 40 to 60% of their excess body weight over a 2-year period. Patients who do well with the band are those whose BMI are under 50. Younger patients who are very active also do well with the band. The sleeve gastrectomy is a procedure where the stomach is made into a tube about the width of a garden hose. Its primary action is limiting the amount of food you can physically eat. A small amount of food will make you satisfied. The sleeve gastrectomy also works by reducing powerful hunger hormones and also transitions the food faster into the small intestine. This then triggers signals to the brain for you to stop eating.
The Roux-en-Y gastric bypass works by reducing the capacity of your stomach and not allowing all the food eaten to be absorbed. Normally, the stomach is the size of a football. This is surgically reduced to the size of a ping pong ball. This limits how much food someone can eat and is one reason people lose weight. There is also a rerouting of the small intestines. Food travels down the roux limb, while enzymes and other digestive elements travel down the biliopancreatic or BP limb. It's not until the two limbs come together at the common channel that food is broken down and finally absorbed into your system. With this procedure, patients can expect to lose between 60 to 80% of their excess body weight. This is about 1/3 of the weight you come into the operating room. As Hawaii's leading surgical weight loss team, our goal is to prepare you well for surgery. This means making sure that you are a good candidate for bariatric surgery and that the timing is right. Our multidisciplinary team of providers will work with you to ensure not only a successful operation, but also a successful transition into your new life.
Before you can have surgery, it is important to make sure you are healthy enough to undergo surgery without a high risk of complications. At the Queen's Comprehensive Weight Management Program, you will work with a bariatrician, a physician who has trained in primary care, but also has additional training and experience with bariatric surgery patients. I'm a bariatrician. I work as part of the multidisciplinary team. I will coordinate with your primary care physician, any specialist you may see, to ensure continuity of care before and after surgery. I also work with the CWMP psychologist and dietitian to prepare you for surgery.
The role of the psychologist is to help prepare you psychologically for the lifestyle changes that will support your weight loss goals. Before surgery, the first thing we want to do is get to know you. We do this by interviewing you and also having you fill out some questionnaires. This helps us to identify your strengths as well as create a plan that will support your weight loss goals. Leading up to surgery, we explore some of the thoughts and behaviors that may have contributed to your health issues. We also help you create and implement new behaviors aligned with your weight loss goal. Finally, we prepare you for the lifestyle changes that will support long-term weight management.
When you see the dietitian, we'll be focusing on how your diet plays a role in treating health issues and managing weight. Your dietitian visits will include education on how to make balanced food choices and emphasize how to meet your nutrition needs after surgery. We'll work on shaping your food choices and eating behaviors towards habits that increase your success and well-being after surgery. Keeping a detailed food log is an essential part of the process, as it allows us to track your progress and provide you with feedback. We also offer guidance on meal planning, meal preparation, and reading nutrition labels.
The team is wonderful. I like everyone there, the nurses, the receptionists, the doctors. They're so nice. They welcome you with open arms, and they're like family, and they are family. Once you get used to coming here, you understand what I'm talking about. They take you in, and they kind of help you and mold you and practice with you and get everything ready so your mind can be ready for the things that's going to happen.
I knew I had to do something, and the psychologist really helped me get through all the barriers I had, and they helped me do everything I needed to do.
I worked with Dr. Rudnick, so she was my biggest cheerleader. She was always in my corner, and it was great because the way she helped me was always being there as motivation. So she wanted to make sure that if I had any questions, any concerns, I could contact her through my chart. I could call the office and ask a question. But that was nice. It was like having your own personal cheerleader in your corner, ready to help you to get you through the process.
Before surgery, I committed myself to go through it and not hold back and go through the program, listen to everything, write all your food log and get in your food log and continue to do it, and every week. You can't cheat, because they'll find out. You can't get away from it. You just have to continue to go through it and continue to press forward, and your life will change because of what you had done.
Generally, it takes about 3 months for a patient to complete the preoperative process. This will vary depending on your individual circumstances.
Once a patient is cleared by the team to have surgery, they will meet with either one of our 2 board-certified, fellowship-trained surgeons to discuss which is the right operation for them. The actual surgery usually takes 1 to 2 hours. Patients then recover in private rooms and are cared for by specialty nurses who are trained in the care of our bariatric patients. On the floor, you will also be visited by the team before you go home to answer any last-minute questions. Patients are usually sent home the next day.
My recovery was great. I mean, there was no pain, there was little pain at all.
The pain wasn't nothing for me. The recovery wasn't bad. The next day after surgery, I was walking around the hospital feeling like a champ. After 2 weeks, I wanted to go on hiking and do all kind of stuff.
I always remind patients that surgery is only a tool. The real work happens after the operation, and the actual cure happens here in the head when patients understand that in order to maintain a healthy weight, they need to be mindful of what they're eating and making sure that they stay active. For many, it's the first time they realize they need to make themselves a priority. They need to put themselves first. After surgery, patients will lose a great deal of weight in the first 6 months. During this golden period of weight loss, it is important that patients ramp up their exercise and adhere to a very healthy diet. This is the time when patients will lose the most amount of weight and really set the tone for the rest of their weight loss journey.
After about a year or so, weight loss begins to taper off, and after about 2 years, patients have reached their maximum weight loss from surgery. Regardless of what operation someone has, the keys to success are a safe operation, good food choices, and exercise.
The illnesses I had before surgery were sleep apnea. I haven't been on my sleep apnea machine for over 4 months. And I also took 2 pills a day for acid reflux, and I no longer take pills at all.
I don't have an off switch anymore. I'm kind of like go, 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 go. And it's been amazing how much it's changed my health and my overall look on life.
I've just passed my 6-month checkup, and I've exceeded 60% of my excess body fat. I should be at 40%, so I'm really, really excited that I achieved this accomplishment.
Before I lost the weight, I couldn't do a push-up. And my husband's in the military. I watch him do push-ups all the time. I watch him exercise constantly. And I was like, I want to do a push-up, I want to do a push-up. And it's really cool, and it might sound like not a big deal, but I can actually do a full push-up. And now he's having a hard time keeping up with me, which is really great because I'm like, come on, Mr. Military Man, like, come on, you're supposed to be more physically fit than I am. And now he's struggling to keep up with me. So it's cool to see the change that I've made.
The Queen's Comprehensive Weight Management Program has an exceptional aftercare program to help you stay healthy and make the necessary changes to reach your goals.
Close follow-up is important. Patients will see our team of providers at least 6 times in their first year at 1, 4, 8, 12, 24, and 52 weeks. They will then see us annually after that. Patients are also encouraged to attend monthly support groups.
After surgery, I follow all the patients to help decide what preoperative medications can be safely stopped and which ones may need to be continued. I will also follow along your weight loss and try to help ensure that it is happening at the expected rate.
After surgery, we want to continue to be part of your journey towards better health. As you may imagine, there are many positive benefits to weight loss. However, rapid changes of any kind can also bring unexpected challenges. We will provide you support through these transitions and help you remain focused on your goal of weight loss and better health.
My experience that I went through with this is awesome. Very awesome, and I feel so blessed that I did it. And the experience that I went through was a hard work. The journey that I went through was a hard work, but it pays off. And it really pays off, and I have no regrets of the things that I did right now or doing this. And I'm happy with the life I have.
I really, really enjoyed working with Dr. Bueno and Dr. Lorenzo. They are fabulous to work with. They gave me the encouragement and guidance that I needed and are my biggest cheerleaders.
A lot of really interesting people that underwent the same process as me. This is the best opportunity and the best thing you can do with your life. Don't wait till you get older. Do it now while you still have the willpower and the mindset.
I not only have recommended the program to other people, my husband has just joined the program and has started his second month into it. So we will definitely be a healthier family.
And it was actually really nice to be welcomed with open arms, and they looked at me as me, not just another patient to help. They're like, oh, hi Kayla, what can we do to help you? Which was nice. I think it's such a great help, and I will recommend, and I continue to recommend it to everyone that says, hey, you're looking great. Well, this is why.
I'm Charles Kaaba, and over the period of 14 months, I lost 112 pounds.
That's a lot of information, but we hope you found the last few minutes informative and useful to making your decision. To best serve your needs, the Queen's Comprehensive Weight Management Program has clinics at our Punch Bowl facility, as well as at Queen's Medical Center West in Eva, in Hilo, and in Kona. If you wish to move forward or have any questions, please call us at 808-691-7546. Our friendly staff will be glad to assist you. We hope to be a partner with you as you improve your health and change your life. Aloha and mahalo.